From North Korea to prescription drugs, President Trump had a foreign policy win, and he started working on a campaign promise this week.
Loyola Marymount professor Michael Genovese joins us now to talk about it all. Good morning, Professor.
Good morning.
Well, let's start right away with North Korea because we just talked about that. What do you think will actually come out of this ceremony, and can we trust the North?
You had it right when you previously said that it's big drama, but maybe a symbolism. We cannot trust North Korea if past is prelude, and that's why we need to get really verifiable deals if we're going to have any kind of a deal. But Kim Jong-un is ruthlessly efficient and wickedly smart. He's not giving up anything that's of cost to him. He's already developed nuclear weapons. He's already tested delivery systems. They may or may not be able to reach the U.S., but at least that's the fear that we have. And so he has pretty much what he wants. And to negotiate away some of these peripheral things is a sign that what he's probably going to do going into the negotiating system is to say, I'm going to give President Trump something he can claim a victory over, something small, something insignificant to me, but I know that Trump needs victories. He'll do anything for a victory. He's a day trader, and people know that he wants at the end of the day to say, look what I've done. And so I think Kim Jong-un will give him something. I think it makes a smaller deal likely, but I don't think anything significant is going to result, at least not anytime soon.
But the president really did have a good week on the North Korea front. I mean, we had the release of the detainees and then the announcement of the meeting with Kim Jong-un. But do you think that Kim Jong-un is really ready to deal?
Well, I think you're right. The president had some good news, and I think we need to give him credit. The gesture that Kim Jong-un made, releasing the 3 prisoners, was a very good sign. And so I think President Trump deserves some credit because he shook things up. Kim Jong-un deserves some credit because he's where he wants to be, and now he knows he needs to get into the international economy and get some relief there. And President Moon of South Korea deserves a lot of credit because with the Olympic diplomacy, he really started the ball rolling. And so let's give credit where credit is due. The president said last week, everybody thinks, those are his words, everybody thinks I should win the Nobel Prize. Well, we don't have a deal yet, and we may get a deal, we may get a good deal, but let's not be too premature about this. It's like me saying, you know, the book I'm writing now, everybody thinks it's going to win a Pulitzer Prize. I haven't written it yet. Let's wait until we see a deal before we start handing out prizes.
And back on the home front, Professor, the president announced his plan to lower prescription drug prices. Technically, this is something that should garner support from both sides of the aisle.
Well, in point of fact, the proposal that the president made during the campaign, which I applaud, and it was really from the Democrats, and he took it under his own wing quite wisely and quite rightly, that he was going to have Medicare negotiate drug prices.
Right.
You can get a great discount when you do that. In the United Kingdom, and Dave Bryan's report was excellent, in the United Kingdom they pay 1/3 as much as we pay for drugs. Why? Because they use their national health system, which is big and powerful and a lot of money, and they negotiate with drug companies and they get a good deal. The president promised that in the campaign, and this is a promise he did not keep. What happened? He caved into Big Pharma. Big Pharma, and you saw it, their stock prices went up. They're very happy. They're going to get nickeled and dimed a little bit. There will be some savings here and there, but the big thing that was bipartisan, at least I know the Democrats were very much in favor of it, is let's let Medicare negotiate and get good prices. The president backed away on that.
But as you mentioned, I mean, the stocks went up, but is it because the plan will help those companies, or is it because it's not as bad for them as investors thought?
Yes. I mean, on both counts. On the one hand, it was a big relief for Big Pharma to know that what they most feared is not going to happen. We're not going to have the government negotiating from strength, but we'll have private companies which are much weaker. And so I think in that sense, it was great relief. But also, investors are saying, well, if the president's going to give them the green light and not restrict them, this is where we're going to make some big money. You make tons of money off Big Pharma, and that's why there's a powerful lobbying group. That's why they hired Michael Cohen, not to drain the swamp, but to get into the swamp.
All right, Professor, thanks to have you. Thanks for being here. We appreciate it.
Thank
you.
Great
insight.